Hi, my name is Lynn and I am a registered nurse. I worked at the bedside for 30 years and took up CrossFit to strengthen my back and address some issues that I had developed over many years at the bedside. And I started working with Maddie several months ago after I started CrossFit, and just noticed that a lot of my joints felt stiff, and I watched what Maddie was doing here in the gym with some of the other clients, and decided it was probably time to see a physical therapist to address my scoliosis and enable me to continue with my fitness journey. So the really cool thing about working with Maddie is she works with me right here in the gym. So she's very familiar with CrossFit and a lot of the movements that we are asked to perform in CrossFit. And a typical session with her would be a short interview. We start at the beginning. She'll ask what is bothering me the most. And initially it was, I didn't even know how to answer that question because, with scoliosis, I was having issues head to toe. So we started at the top. And she just addressed some imbalances and weaknesses that I have in my core. And a typical session would be she might address those with some needling just to loosen up the muscle, and then give me specific exercises to help remedy the imbalances that I have regarding the scoliosis. Many things surprised me, and the biggest one was the postural issues, which were coming from weakness in my backside. My weakness in my glutes, which I realized I really wasn't accessing because of my tight quads and tight core, so I was not able to access my glutes. So I was using my low back for everything. And so my low back was sore all the time. My calves were sore all the time because the muscles that were supposed to be firing, I had no access to, and I didn't realize it until she started giving me specific exercises. So before I started working with Maddie, when I would practice my Muay Thai or some of the movements in CrossFit, I felt very just disconnected. I didn't feel like the muscles in my core were working in conjunction with the muscles in the rest of my body. So all the movements felt very off balance and disjointed. So since I've been working with Maddie, and she's brought my attention to a lot of muscles which I had really just forgotten about and wasn't using. So I was compensating with other muscles, and even though I was feeling better and better from the exercising, I really wasn't making the progress that I felt that I could be making if I specifically addressed my scoliosis and the issues with that. I believe that if you are looking for a physical therapist or a group of physical therapists who are ready to work with you and keep you active and happy and healthy and involved in the activities that you are interested in, these folks are the way to go. Having been a nurse for many years and knowing that I probably should see a physical therapist, I was really hesitant to see the conventional physical therapist because I felt like they would tell me to stop doing what I'm doing and not really give me the tools that I needed to empower myself to decide how I'm going to move forward in life and my health and wellness journey.